Hey guys, Dr. Berg here. In this video, I'm going to show you an amazing technique to relax your head and your neck. It's called the cranial relaxation technique. There's 3 different steps, and you're going to need someone to either do this on you or you to do it on someone else, okay? So I'm going to have you practice this and then post your comments below. Let me show you. Okay, so this first technique is very, very simple. You're going to be working something called sutures. There's a suture, which is a joint on the skull that comes right down the front this way, okay? And you need someone to do this on your body because it's hard. Someone's going to hold your forehead here, or you can hold someone's forehead, and you're going to start with your thumb right here, and you're going to press this way. So you're going to traction forward, so the skin is going forward, and so we have a from back to front effect starting right here. And you're going to hold that pressure forward, okay? For about 60 minutes. No, I'm just kidding. And then we're going to inch forward, a little bit forward. So we're just going to keep going more forward, more forward, more forward. The only time that you wouldn't do this is if someone had an injury to the top of the head. That's the next technique I'm going to show you. Okay. And then the other problem is that you mess up the person's hair. So I'm just going to kind of go forward here, and I'm tractioning this way. I'm going forward. What I'm doing is I'm creating a lot of space in the skull. It helps to have big thumbs like I do. We come this way. Okay, so we started here and we just inched forward right here. So how does your head feel?
I feel the energy moving in it.
Good. Good. So does it feel any more relaxed?
Yes, it does.
Yeah, that's the point. You're going to actually, your whole head's going to feel kind of relaxed, because what happens, especially at night, is when you try to go to sleep, like sometimes there's a lot of tension in the skull. When you do this, it releases the tension. So the first technique is start here and go inch forward right there, okay? In the next video, we're going to show you step 2. Hey guys, welcome back. In this video, we're going to talk about maneuver 2 for the cranial sacral relaxation technique. This is really good if someone has an injury to the top of the head. Let's say they bang something on the top of the head. Oh my gosh, this would be wonderful. And what you're going to do is you're going to take the skull and you're going to, you're not going to squish it forward. You're going to kind of go forward this way. You're going to push the skull together. So we're pushing up like this. And we're tractioning around towards the center. Okay, so I'm going to hold that pressure for about 30 seconds. And for video purposes, I'm just going to shorten it so you don't have to watch me for 30 seconds. And we come again, and we come right into it. And if someone has a big head, you would do the front part first, and then you would do the middle and the back part right through here. And this does wonders for your hair. So I'm actually squeezing and I'm pulling upward. Now, if you could, also when someone has a fall, like an injury to the top of the head, you could even grab their hair and pull it and traction it up. And some people it feels really, really good. So what did that technique feel like?
It feels light, more relaxing. I feel my sinuses kind of opening up.
Awesome. Okay, so the first technique was coming down the center. The second is basically taking the skull and pushing it up here. You have a lot of sinuses, cavities that are up in the skull through here, and this will help get things moving. Okay, so in the next video, we're going to show you step 3. Okay, so in this section, what we're going to do is we're going to work on the articulation between the skull and the neck. And there's all these ligaments that attach in the back of the neck to the skull. The back here, this back part of the skull, this is called the occiput. Okay? So what we're going to do is we're going to actually stretch this part. Okay? I like to, again, hold the forehead, take my thumb, and her hair is down here, so it'd be easier to do this on someone that was bald. But anyway, I'm going to take my thumb right up underneath the skull, okay, and I'm going to lift and flex. Okay, so I'm stretching it up. So I'm taking all those ligaments. Ligament is bone to bone, and I'm stretching them. Okay. Now, when I stretch, I like to use this part of my thumb just so it's more comfortable, so it's not so sharp. Okay, so I'm going to stretch and flex like the basketball. You're moving like a ball on top of a pivot or a bowling ball. So we're going to come here. Now, I'm going to stretch this 2 or 3 times. Okay, I'm going to make her taller. Lifting up. And this hand is just to guide it. Now I'm going to work my thumb over this way, lifting up and stretching forward, pivoting around the center. So I'm really lifting up and I'm going forward, okay? So I'm working my way around this little curve here. So I did the left side. Now I'm going to take my finger, middle finger, and I'm going to hook the other side up underneath here, and I'm going to lift it and stretch it like this. Up underneath the skull, stretch it. Now I'm going to come a little bit further over here and stretch it right here. The key is getting the angle just right. So we're taking the entire back of the skull, which is called the occiput, and getting it all nice and stretched. Okay, now, how does that feel?
It feels good. It feels relaxing.
Yeah, if you did this, you would make the person want to take a nap.
Yeah.
So that's how you do the cranial relaxation technique. All right, so that's how you do it. So here's what I want you to do. Your next step is to practice on someone that you know, a family member, a friend, your spouse, and post your comments below. Thanks for watching. Hey guys, thank you so much for watching. Please click the subscribe button, and I will see you in the next video.